Welcome to another episode of The Radio Vet with Dr. Kelly, the show that's about cats and dogs, but not necessarily for cats and dogs. So I don't think we have any animal listeners. I haven't gotten any letters or anything.
No,
so,
no questions.
So I know. Yeah, or complaints. How dare you say that about us? So what is our topic for today?
Today we're going to talk about eyes. And all of the things that are normal and abnormal about them.
Well, I feel like I'm going to feel really funny about this, about myself after this episode, but let's see where it takes us. So
one question I get a lot in practice is about what can dogs and cats see in terms of color?
That is interesting because ultimately at the end of the day, I mean, it's interesting, I guess, on a National Geographic level, but like, who cares? I mean, like, it doesn't change my relationship with my dog or cat.
True.
I mean,
although someone was telling me the other day how she couldn't believe that when her dog, who loves to play ball, get the ball, bring it back, get the ball, bring it back on, an endless circle.
Doesn't take much for that bunch.
That if the ball was moving, of course, the dog could go right to it and see it. But if the ball came to a stop before the dog got up to it, even though the ball was bright orange against the dark green grass, he had trouble seeing it.
Really?
And that actually makes a lot of sense to me.
Okay.
Because I don't know what color the ball looks like to the dog versus the grass.
Sure.
I'm guessing there's not as much difference to them. But dogs and cats as well have vision that is very tuned into movement.
Okay.
Very, very tuned into movement.
Cats, certainly.
Especially cats.
I was going to say, holy cow.
Yeah, being that they are predators.
Sometimes of us.
Yes.
My Siamese girl's been attacking my daughter's feet regularly lately. And
she should stop wiggling her feet.
She should stop moving. I said you have to cease movement is, a big part of it. So, okay. Well,
so when something is still and against something else, they have a harder time distinguishing those things as separate.
Okay.
Yeah.
So color is lower.
Color is less important.
Lower on the list. Okay.
They have less ability with color. They you may have heard about rods and cones.
Oh, sure. Absolutely.
And the more cones you have, the better a species color vision is. Basically, they have a lot more rods. They gave up color in order to have better vision in low light.
Well, it's a survival thing too.
Exactly.
Ultimately, yeah. So buying a dog a mood ring really is
not impressive to the dog at all. No. And it's not that they don't see color. They do see colors. They just see, we believe, a different spectrum. Yeah.
Interesting. Has anyone ever kind of done a study where, like, let's show you what your dog's world looks like, a picture or an image?
Yeah.
And just, I mean,
people have tried to do that. I have no idea how you can know for sure.
right. Until you're a dog yourself,
right?
There's just not much you can do. Okay.
But I've also been heard that birds, like parrots, brightly colored birds, they see more colors than we do.
That's not fair.
Yeah, I know.
Of course, if you're that colorful, you should be able to enjoy yourself.
You should be able to see it. Yeah, yeah. There's got to be a reason for that.
All that preening, Interesting. So with the, I don't know if you want to break this down to cat eyes first, then dog eyes, or eyes in general, I guess.
We'll start off with eyes in general.
Okay.
So what is an eye?
Sit down, kids.
So the first part of the eye that you may notice would be the eyelids. The skin has glands and hair associated with it, but dogs and cats have a third eyelid, which humans lack.
Yes. That thing's creepy. I hate that thing. I don't like it. You walk in and they're sleeping and the first set's open, but the second set's closed. So basically you just got a scene from The Exorcist on your couch. It's just terrifying. And they're twitching and it's just a bad scene. I don't know.
So the third eyelid, or the nictitating membrane, as it's called.
Okay. Now I have a name for my pain. Good.
But then there's the cornea, which is like the window, the clear glass window into the eye, or the windshield, if you will. Yes, the cornea is the windshield. Then behind that, there is a chamber of clear fluid. Then the colored muscular ring known as the iris.
Ah, yes.
The hole in the middle known as the pupil.
There we go.
Behind the pupil, there is a lens, just like our eye. And behind the lens, there is another chamber. Rather than being a watery fluid, it's more like jelly, called the vitreous.
Gross.
Yeah, gross. And then there's the retina, which is a multi-layered, complicated structure that basically is blood vessels and also is the layer where the optic nerve is. The optic nerve comes directly out of the brain to the eye.
It's kind of the Intel processor of the entire eye. Yeah, absolutely.
And then under the retina, there are some crystal-containing cells that bounce light back and forth. So when light enters a dog or a cat's eye, or even, let's say, a deer, when light enters their eye and it makes it all the way to the retina, it makes it, to this crystal-containing layer that actually bounces it back through the retina a second time.
I wish we had that.
That is the layer called the tapetum. And that's what you see in your headlights in the dark when the deer is looking at you.
When you're in
exactly.
The stuff that horror movies are made out of.
That's what allows them to see better than we can in low light. Because their light passes through their retina more than once.
It's unfair. It's totally unfair. We are such flawed beings compared to
we're just missing that advantage.
As we were talking before the show, cats and dogs don't have to own cars, and their eyes get to glow in the dark.
Right.
That's just
they have night vision.
It's all cool. It's cool stuff. I don't know. We can get that retroactively put in or something. I don't know. I don't get into that business. So, well, a big, let's debunk or bunk a myth here, in that people say cats can see in the dark. True or false?
They can't see in the absence of light. They can see in low light.
Low light, okay.
Way better than we can.
Certainly, absolutely.
Yes, but in the absence of light, no, they can't open their eyelids and have light shoot out and see anything.
That's reserved for the son of Krypton. Superman only. Okay, well, and again, it serves them well because they're nocturnal creatures, and if they don't have us pouring kibble into a bowl, they need to find something to eat, and so they will devour other lovely nocturnal creatures. Yeah. It's a beautiful thing.
Yeah, they'd be very unsuccessful hunters without their wonderful eyes.
Right, absolutely. And dogs, not as much, though, right? I mean, less so in low light or better?
No, I think they're probably pretty similar as far as their low light vision goes. What's interesting, I think is interesting anyways, is that, the cat's pupil is vertically oriented.
Yes. Scary.
And dogs have a round pupil like ours.
Indeed.
Yes. And then a prey species such as a goat or a sheep or a horse, they have horizontally oriented pupils.
Interesting.
Yeah. There's a reason for that.
I was going to say, is that a food chain thing, basically?
It is.
It
is.
Okay.
If your pupil is oriented horizontally, you have a wider field of vision, so you can watch out for predators.
Much more cinematic.
Yes.
That, wide
if your pupil, like the cat's, is vertically oriented, and you are more sensitive to the tiny movements of tiny creatures that pass through there. Yes.
Very nice. So cats are more television style and horses are more movie style, basically.
Yeah,
right.
sure. Yeah. And dogs are like us. Dogs are actually omnivores. They're like us.
Right. They're just waiting for...
They'll eat whatever they can.
Waiting for Alpo to show up in their bowl, It's all they need to worry about. So, because they're cute,
Yeah. So there's various common things that are seen in practice as far as what's wrong with eyes or what goes wrong with eyes.
Sure. Yeah.
So starting with the eyelids again, a common thing that we'll see will be something called entropion, in which a upper or I think more commonly a lower eyelid will roll in so that the hair is touching the cornea.
Oh,
very uncomfortable.
Yeah.
Yes, it will scar the cornea in the long run from that abnormal contact. Some dogs and cats are born with this as a problem, so it can be an inherited issue. And others, if they have pain in their eye for some other reason, they'll develop what's called spastic entropion, where it's a muscle spasm that's causing the lid to roll in abnormally. And once you take care of what's originally wrong with the eye, that'll solve itself.
That's like the stray chihuahua we took in a few years ago who had something they called it like cherry eye or something.
Yes.
Is that the same thing then?
No, cherry eye is a whole other problem. That is a defect with the third eyelid.
Oh, the one I don't like.
The one that doesn't have any hair.
That one.
But that's cherry eye is a term that refers to the luxation of the gland of the third eyelid. So the third eyelid has a gland that makes tears. And so it's a very important gland. It's not the only tear gland in the eye, but it does contribute a major portion of the tears. But that gland can pop out of place.
There we go.
And then when it does, it's this red blob.
Yeah, it's gross.
That's sitting in front of the eye.
It's just not pretty to look at. I felt terrible for her. She was, but again, seemingly born with that, I guess.
Yeah, so dogs who are in the what we would call the brachycephalic group, dogs with the smushed in faces, they're much more prone to that.
Okay.
Yeah, so it's kind of an inheritable problem in them, or a anatomical problem.
Okay.
Yeah. So that gland, ideally, when that is popped out of place, it needs to be replaced where it belongs. Just like, if your shoulder were out of joint, you'd want it put back.
It's like having an interior decorator. Yeah. I want that over there. I'd like that gland back over there, please.
Yeah, exactly. so there's a couple different, surgeries to tack that little darn thing back down where it belongs, behind that third eyelid, and keep it there, hopefully.
little scotch tape, some bubble gum, we'll get it right where it belongs. Sure. All's good. Like this old house. Excellent. We're going to take a break. Today's episode is brought to you by the word luxation. It's the first podcast I've ever done where the word luxation was used. We'll be right back with more luxation. Back on the Radio Vet with Dr. Kelly, our show that comes to you from the Cedarburg Public Library with a Mequon vet. Figure that one out. Huh?
Who lives in Cedarburg?
Who lives in Cedarburg? It's also confusing anyway. But we're talking about eyes today, and those things that kind of are either side of your nose, and how they work in pets, and some of the things that can unfortunately go amiss.
Yeah. So let's talk about tears for a little bit. Yeah. So
lately, a lot. It's been a rough year.
Yeah, there's a lot of white dogs out there with brown streaks going down their faces.
I have one of those.
Yeah, so that's tear staining.
Yep.
It's called, and caused by epiphora, which literally is literally a medical term for tears spilling down the face.
Luxation and epiphora today.
In fact, it's often called poodle epiphora because white poodles almost always have it.
Do you ever use these words just in your daily? I mean, when you're not like in the veterinary clinic, like you're out and about, like, hey, you're over the Java House, you're like, epiphora.
Look at that dog. It's got poodle epiphora.
It's got luxation.
No.
It's just within the walls of Easttown. Very good. Okay. I'm glad to hear that, actually.
Yeah.
So anyway, these are draining poodles are leaking everywhere.
So this tear staining can be the result of anatomy that they were born with. It can be the result of hair that is abnormally touching the eyeballs and wicking tears off the surface of the eye and down into the hair and down the face.
Sure thing.
So, that's a simple fix. That dog needs, to have its hair in front of its eyes kept a lot shorter.
Absolutely.
They can also, though, have abnormal drainage. So tears are produced to, keep the eye healthy and bathed in a healthy fluid. But they also have a normal drainage system, and it's not supposed to be down the face.
Right.
And when that drainage system is either missing or plugged up because of a previous infection, more tears spill down the face. So the drainage system can be abnormal. Part of that drainage system are fine canals that begin on the lower eyelids and end near the tip of the nose.
Okay.
Which is why dogs' and cats' noses are always wet.
Right.
They are wet with tears.
Oh, interesting.
Yes. We have a similar drainage system. That's why we have to blow our noses when we cry, because we have tears come out our nose,
but
too.
I was going to say, we keep ours on the inside, not the outside, whereas, which is good, because I don't want to have streaks on my face, It's like bad kabuki theater all day or something. It's very, very strange. Yeah, we are Saint. What is that? Saint Charles Cavendish, whatever.
Yes.
Yeah. She's a big leak face. She's just draining all day long.
Yeah, and she's one of those who would be kind of included in that, smushy face, slightly smushy face,
very smushy,
but also bowling ball head kind of
very
breed.
bowling ball. Yes. All of this is accurate. Yeah. She's a thick girl. She's a small dog, but she's just thick. Like not chunky, but like just
tank-like.
Yeah, tank-like. She's just barrel-chested, big skull. Battering ram.
Not sure this is a Cavalier King Charles Spaniel.
Oh,
I'm
maybe.
just kidding.
Well,
dogs who are tank-like are the bully breeds, like the English Bulldog, the French Bulldog, and then also I always think of Schnauzers as these tough little tanks. Also Australian cattle dogs, man, they're tough.
Okay.
Oh my God.
Yeah, but she's so small. She's a tiny thing, but she's just
barrel-like.
But bulky.
Yeah.
I mean,
Okay.
it's kind of nice. It's fun to pet because she's just like you're like, I'm really petting something here.
There are also cats who have these streaks down their face.
Oh.
Usually, also smushy faced cats, like
sure.
the Persians, for an example. Some of them have abnormal drainage for anatomic reasons, or they're missing the normal drainage system. But some cats with chronic tear staining down their face have a viral reason for that. So a chronic upper respiratory virus, actually a variety of herpes.
Oh boy.
Is very common in cats, and it's also a common cause of tear staining.
Okay.
Yeah.
All right. So, well, how as pet owners can we be sure, that our besides taking them to get new glasses. I mean, how can we be sure their eyes are doing well? What should we look for? What's our yellow flag on the field for this sort of thing?
Anytime your pet is holding an eye partly closed, that eye is uncomfortable for a reason. Right. Yeah. And one of the most common causes, besides just, I got something in my eye, would be a corneal ulcer or corneal abrasion. Causes a great deal of irritation and actually a fair amount of pain. And so they'll hold that eye not all the way closed, but like 2/3 to 3/4 closed.
Sure.
A lot of the time because it just hurts and it feels better to keep the eyelid over the wound.
Yeah. There's a fun, sweet cat who's outdoor cat in our neighborhood that we call Winky. And Winky walks around with her left eye closed all the time. And
does she have a left eye?
She might not. I don't know. I haven't gotten close enough.
That might be a thing.
Lack of eyes is keeping that one closed. Yeah, she's definitely. I mean, she's outdoors and she knows that neighborhood well.
Yeah.
She's funny. When you're out for a walk, she follows you. And talks to you the whole way.
She's hoping for a handout.
I would think so. Yeah. I mean, but when you get too close, she's not thrilled with contact. But she'll rub against your legs as long as it's on her terms. Fascinating.
Yeah.
But Winky's definitely got some eye issues going on, or lack thereof, as you indicated.
Possibly.
So yeah.
Yeah. So what else can happen to corneas that you may notice? So a quote-unquote typical corneal ulcer or abrasion, a sudden injury to the surface of the eye that causes a little scratch, if you will heal very, very quickly if, dealt with. Usually it involves putting either an ointment or a drop in a couple times a day for about a week. I had a corneal ulcer once, or a scratch on my eye. It was extremely irritating. Could not keep my eye open to save my life.
Absolutely.
And for me, it was probably easier because corneas that are healthy heal super fast. All I had to do was wear an eye patch for 24 hours and it healed itself. We don't use eye patches in animals.
I mean,
it's just difficult.
It'd be so cute.
It would. We don't really do that, even though the cornea would heal faster if we could. But, keep essentially putting a layer of medicine over the wound on the surface of the cornea is enough to allow it to heal on its own over a few days.
Yeah.
However, some corneal ulcers are spontaneous, meaning it wasn't an injury. It's an unhealthy cornea to begin with. These are spontaneous corneal ulcers. Boxers are famous for these, and they take forever to heal.
Well, boxers have those weird goggle eyes. They're just like
they do. It's not that the eyeball itself is weird. It's that the orbits that they sit in are shallow. Just, like any dog whose eyes really bug out.
Right.
The eyes aren't any bigger. They're just further forward because the bowls they sit in are more shallow.
It seems like with boxers, when they enter a room, the first thing that comes in is the the eyes. It's
Yes,
just like,
that's
it's just
true.
so
Yeah, because the
strange.
nose is so pushed in.
It's just like eyes out, chest in. All right.
Yeah. So
Fascinating.
some corneal ulcers get so deep and so nasty that the eyeball can rupture.
Oh, geez.
Yeah.
Now that's got to be painful.
And disgusting.
That too.
Yeah.
Wow.
So
Okay.
anyway, enough of corneas.
Yeah,
Gross.
let's move on. From that. What about like retinal issues in
retinal
pets?
degeneration does occur
Okay.
in pets. A while back, I mentioned a client whose dog I discovered had cataracts as she was getting older, and the client took her to a veterinary ophthalmologist in our area because she wanted to find out about having the cataracts removed because
Wow.
she didn't want her dog to go blind.
Okay.
So the veterinary ophthalmologist, very wisely, as they should, checked her retinas, and even if the cataracts are complete and the pet is blind because of the cataracts, they
Sure.
can still test the retinas to see if they are visual,
Okay.
meaning the nerves work.
Yeah.
This dog had retinal degeneration,
Oh,
so he
wow.
said, "Don't bother getting rid of the cataracts
Right.
because your dog's losing its vision anyway."
This must have been a pretty ancient pup. I would
No,
think.
she's probably about 10.
Oh wow. Okay.
Yeah,
So,
but she was just a very motivated owner.
yeah.
Yeah.
I see.
But dogs do get to have their cataracts removed sometimes, and there is a man-made lens that can
wow.
be put in their eye.
Wow.
Yes. Yeah. hmm
Sounds real inexpensive.
Yeah. Sure. Yeah.
So, get a second mortgage out for my dog's eyes.
Yeah. I mean, it's certainly not the average pet owner
Yeah.
that does that, but they do exist, and the veterinary ophthalmologists are really busy.
So
They really are.
with those few. I guess so. Yeah. It's,
There's just a lot of other eye diseases, unfortunately.
Okay.
One of which is glaucoma.
oh, sure.
Yeah. I hate glaucoma.
Well, you get those little puffs in your eyes when you go to the eye doctor. That's always fun too.
It's so glaucoma. What is that? That is simply, a simple definition would be higher than normal pressure inside the eye. So I believe in humans we have a really nice drainage system again
Sure.
inside the eye for the fluid in the eye in order to regulate our pressure. Dogs and cats have a very different drainage system that does not lend itself well to surgery for
Okay.
glaucoma. So surgical treatment for glaucoma is rather thumbs down for
Okay.
pets. It's not the same as it is in people. There's hereditary glaucoma, which tends to strike pets in midlife.
Okay.
And then there's a lot of secondary glaucoma that happens because they had something else wrong with their eye to begin with.
Oh, boy. Okay.
If a dog or a cat has a cataract, that lens, you're going to like this, is at risk for luxation.
Hey, the word of the day. Now I have to pay you $50 or something. I think.
So lenses that have cataracts are at risk for popping out of place and floating around in the eye.
Ooh, that's
And that causes glaucoma.
extremely unpleasant. It sounds like.
Yeah, it's not nice when you look at an eyeball and the lens has made it to the front of the eye.
Ooh, that's a lot
Yeah, it's in
of
front of the pupil. It's like,
degeneration
whoa,
there. Yeah.
that's freaky.
So yeah, right. So the biggest kind of question of the day, besides the wonderful word luxation, is quality of life. That is a big part. With our 17-year-old Chihuahua that we did put down, his blindness, which was noticeable and substantial. We didn't need a vet. We knew that when he's running into walls and falling off the bed,
He was demonstrating his blindness.
Yes, he was showing us, letting us know. And then we started sort of having quality of life conversations.
Okay.
And so can the eyes be is a deal breaker for pet owners? Is it a point where you're like, oh boy, this just is not, how would you advise someone on that too? That's really a problem.
I mean, the biggest, of course, thing is the pet comfortable?
Right.
Yeah, because glaucoma causes a tremendous amount of pain when it's untreated. People describe it as the worst headache you could imagine.
Oof.
Okay,
Yeah.
so if a pet has glaucoma and medication is not controlling it, that's an eye that's got to go.
Yeah.
And there may be a tumor inside the eye that's causing glaucoma. There may be, but anyway, if an eye with abnormally high pressure stops responding to topical and oral treatment to lower the pressure, that pet is in, potentially a lot of pain.
Yeah.
The eye may already be blind.
Yeah.
And in a lot of cases it is. And I'll admit that's one of my favorite surgeries is to remove a bad eye.
Really?
Yes.
You heard it here first, folks. Now, at the end of the year, we have our Dr. Kelly quiz. Remember, removing eyes is her favorite.
Enucleation. Enucleation.
This is my favorite.
One of my favorites.
This is my favorite episode, that's for sure. All these great words you're bringing today. This is fantastic. As a librarian, you understand, of course,
Yes.
words is our bread and butter. So, great. Wow, cool. So there you go.
Yeah.
Eye removal.
Eye removal. So a particular patient who I always remember when I talk about glaucoma is an elderly Shar-Pei. So the wrinkly skin dogs.
Yeah.
Wrinkly skin. She developed bilateral glaucoma. Both her eyes were affected. And even though the owner, who was a physician, was really good at, keeping up with her multitude of treatments and drops, she went blind. She was not comfortable. He asked me to remove both of her eyes. We did. She was a much happier dog.
Wow.
So much happier for the last 2 years of her life.
She did 2 years in darkness.
She was already blind.
That's true. Okay.
There was
She's done multiple years.
The only
in
thing
darkness.
I did was take away her pain.
Take the pain away. Absolutely.
Mm-hmm.
Yeah. And probably made her slightly less, attractive when she goes out on the town. I mean,
Yeah. There are, I've never put one in, but there are, not fake eyeballs, but
Sure.
a prosthetic so that the lid doesn't sink in.
Oh, sure.
You know what I mean?
Absolutely.
Yeah. Yeah. Because that's a little disconcerting for people to sometimes see the sunken in lid where you can see the orbit in the skull.
Right,
Yeah.
right. Wow. How did this Shar-Pei just kind of get around? I mean, and get to her food bowl and,
So they get around very, very well if their blindness comes on gradually. In fact, many people whose dogs are blind are surprised when I tell them, "Did you know your dog's blind?" Because it happened gradually enough that the people didn't notice.
Wow.
Yeah, they didn't rearrange their furniture. They didn't move anything the dog needed
Worst
to get
thing
to.
you could
They
do,
didn't.
of course.
They didn't move to a different home.
Sure.
So
Absolutely.
they never noticed that their dog couldn't see.
So it's just all about kind of internal compass,
That and their sense of smell is
That's
a huge part of
true.
navigation.
That's true.
They're, elderly pets, I don't know that their hearing is able to become more acute as it seems to,
Sure.
For people who lose their vision, or if they just are better at paying attention to what they've got left as far as hearing goes.
Certainly,
but they adapt beautifully.
That's amazing.
Yeah.
Yeah. And smell, like you said. I mean,
Yeah.
in fact, a new puppy, with all their senses working at 11, working at full capacity, the nose still probably out, is more important than the eyes.
Really young puppies have not learned to use their noses. I've noticed that.
Interesting.
When I put treats on the table in front of them, they look. And if they didn't see me put each treat there, they fail to get them all because they don't bother using their noses yet.
Okay.
So I do see them at a very, very early age. They're all about the eyes.
Okay. So eventually the nose will outfox.
Eventually the nose seems to kick in. Yeah.
Well, I guess that stands to reason. So interesting. Wow. A ton of eye information here on you could call this an eye episode, like iPod, iPad, eye episode. We do well. Episode. There we go. Excellent. So we have to move on to the nose at some point in the future. I don't know if we've ever done a nose episode. I'm just dropping ideas here.
There's just not that many illnesses for the nose. It's not that interesting.
Tune in next week for a cold. All right. Well, this has been the Radio Vet with Dr. Kelly and everything you possibly could want to know about eyes. And go back and review because you're going to get like 8 golden money words in this episode. I'm going to go back and listen.